Hello and welcome to another episode of PsyWicV. My name is Huy, and this is the first episode in a series of 5 about anxiety. In this episode, we're going to talk about types of anxiety disorder, and in later videos, we'll talk about managing anxiety disorder, treatment, common medication, and how to cope with anxious thoughts. Please remember to check out the affective playlist in order to learn more. Let's go. Anxiety is a normal reaction to stress and can be beneficial in some situations. It can alert us to dangers and help us prepare and pay attention. Anxiety disorder differ from normal feelings of nervousness or anxiousness and involve excessive fear or anxiety.
Anxiety disorders are the most common of mental health disorders that affect nearly 30% of adults in the US at some point in their life. Anxiety disorders, however, are very treatable, and there are a number of effective treatments available. Treatment helps most people lead normal and productive lives.
The most common types of anxiety disorder in adults in the US include: first, specific phobia, 7 to 9% of the population. It is excessive and persistent fear of specific object, situation, or activity that is generally not harmful. These fears cause such distress that some people go to extreme lengths to avoid what they fear. An example of this is actor Sean Bean, the actor in Lord of the Rings. He's so afraid of flying in a helicopter that he'd rather hike 2 hours on mountainous terrain in full costume to get to the set than sitting in a helicopter. The second one is social anxiety disorder. About 7% of US adults suffer from this. It is characterized by fear of being embarrassed, humiliated, rejected, or looked down on in social interactions. Common examples are extreme fear of public speaking, meeting new people, or eating, drinking in public. The third one is panic disorder. The core symptom of panic disorder is recurrent panic attacks, an overwhelming combination of physical and psychological distress. During an attack, several of these symptoms occur in combination: palpitations, pounding heart or rapid heart rate, sweating, trembling, shortness of breath or smothering sensations, chest pain, feeling dizzy, lightheaded or faint, feeling of choking, numbness or tingling, chills or hot flashes, nausea or abdominal pains, feeling detached or fear of losing control, fear of dying. Ooh, that was a long list. I thought I couldn't get through that one. Because symptoms are so severe, many people who experience a panic attack may believe that they are having a heart attack or other life-threatening illness and may go to a hospital ER. Panic attacks may occur with other mental disorders such as depression or PTSD.
Agoraphobia is the fear of being in a situation where escape might be difficult or embarrassing, or where help might not be available in the event of an emergency or panic symptoms. A person with agoraphobia experiences fear in 2 or more of the following situations. For example, using public transportations, being in open or enclosed spaces, such as bridges, tunnels, or standing in line or being in a crowd. Sometimes being outside of their home alone might induce panic feelings. This person will avoid actively being in these situations or will need a companion wherever they're going in order to reduce the anxiety and tolerate it. Now, agoraphobia may become so serious that the person might avoid leaving their home entirely. Generalized anxiety disorder, GAD, involves persistent and excessive worry that interferes with a person's daily activities. This ongoing worry and tension may be expressed in physical symptoms such as restlessness, feeling on edge, easily fatigued, difficulty concentrating, muscle tensions, and troubles falling asleep. Often these worries focus on everyday things such as job responsibilities, family's health, or on minor things like attending appointments, completing chores, getting car repairs. Separation anxiety disorder. A person with separation anxiety disorder excessively fears or is anxious about separating from those with whom they are attached. The feeling is beyond what is appropriate for a person's age and may persist for about 4 weeks in children and about 6 months in adults. These symptoms cause problems with their function. A person with separation anxiety disorder may have persistent worries about losing the person they're attached to. They may be reluctant or refuse to go out of their home or sleep away from their home without that person. This person may also experience nightmares about the separation with this person. These symptoms often develop in childhood, but in some cases they do carry to adulthood. Post-traumatic stress disorder, PTSD, is a mental health condition that is triggered by a terrifying event. Either it is experienced or witnessed. The person develops symptoms after the event that might include flashbacks, nightmares, accompanied by severe feelings of anxiety and uncontrollable thoughts about the event. Most people go through traumatic events have some temporary difficulty adjusting and coping with the event. However, with time, most people with good self-care usually do get better. If these symptoms get worse and they last for months, sometimes years, it may interfere with day-to-day functioning and it might develop into PTSD. Some symptoms may be intrusive memories, recurrent or reliving the situation, which then cause avoidance of places or things or triggers that might remind you of that traumatic event and are maybe accompanied with negative thinking or negative moods such as hypervigilance, always feeling frightened, on guard, having trouble sleeping, increased irritability, frequency of anger outbursts, and also in some cases aggressive behaviors.
Just like when the flu virus enters your body, you develop symptoms. Sometimes the symptoms are mild and you can get over it easily. Other times, it's so bad you have to stay home for several days. In the same way, when we are exposed to uncertainty, we get anxious. When we're exposed to fearful situations, we become afraid. That's the human condition. Over 1/3 of the book of Psalms are lament songs in which the authors express their anxiety, pain, and sadness to God. A very special thing about biblical lament is it allows a person to fully express their anxiety, and this is often followed by a statement of trust in God. This combination makes for very powerful prayers. The anxiety, grief, and pain are not hidden, but people do not stay in their anxiety. They call on God and express their faith in Him. The laments encourage people to be honest with God, to speak the truth about their feelings and doubts. To lament God is a sign of faith, not of doubt.
And that wraps up our video today on the different types of anxiety disorder. We hope that this provides you with the ability to know the differences between different types of disorder, and then also to empower you to seek help in understanding that there are effective treatments available to you. Don't let anxiety interfere with your life. Get treatment for it and regain your productivity. We thank you again for your support. Please subscribe. Please hit the like button if you like the content of this video, and we look forward to seeing you in future videos. Have a great day.